The Freudian theory preceded Rogers' theory, showing determinism as it believes that events that happened in the past determine our present behavior. For example, our experiences as children, especially in the ages of the psychosexual stages of development, where infants go through stages that affect them majorly when adults. These stages include the oral, anal, phallic, latency, and genital. If in any of these stages the infant does not receive his needs, fixation occurs, and as an adult he may suffer from a psychological disorder. On the other hand, Rogers' theory of the humanistic approach believed in free will, where a person's behavior can be decided by the person himself. Freud also spoke about the mind and its structure, specifying the id, ego, and superego. The id is unconscious, operates according to the pleasure principle of sex and aggression. The ego operates according to reality principles, where the person acts according to logical thinking. The superego, which is unconscious, works according to moral principles, guided by what our parents and culture taught us. As the id and superego contradict each other, a conflict may arise, where the ego tries to mediate between them. If this mediation is unsuccessful, disorders may occur. The ego uses defense mechanism, an unconscious process that includes repression, projection, displacement, denial, rationalization, reaction formation, sublimations, and others. Of course, there is criticism against the Freudian approach for being unscientific, as it relies on self-report, difficulty in measuring the phenomena or proving or disproving hypotheses, or replicating or performing the scientific process. Unlike Freud, who perceived nature of people negatively, Rogers' theory of the humanistic approach concentrated on the positive side of it, claiming that people strive to achieve their goals and reach their fullest potential. His approach involved introspection that would reveal the client's subjective self-concept. Self-actualization is a key term in the humanistic approach, claiming that every person can reach his highest potential if he was given the chance to grow. However, a person may experience obstacles that may prevent him from doing so, distancing him from his true self. Rogers also established the person-centered therapy, where the therapist takes a passive role in the course of the therapy and leaves it to the client to do their interpretations free from any threat to the self. The relationship is supportive, fostering the client's growth. It holds unconditional positive regard, where the therapist accepts feelings and actions of the client and shows empathy towards the client's point of view. Aim of this attitude is to encourage the client to be more honest with himself and by that reach growth. This approach is more appropriate for healthy people, and it is basically unscientific, as it is based on clinical experience, self-report, and holds no empirical data. Its concepts are also difficult to refute. Although these approaches suffer from all the above, they still have their own influence nowadays. For example, in cognitive psychology, unconsciousness turned to be real in some cognitive processes, while elements of Rogers' therapy is still used in counseling and clinical settings, such as showing empathy, honesty, and support to remove barriers, and by that, the client explores his true self. On a personal level, many elements of Freud's theory seem to be pseudoscience, such as dream work or the psychosexual stages, but some others seem to have some basis, such as unconsciousness and defense mechanism. On the other hand, Rogers' work seems to be more reasonable, although it may seem unscientific. If I need to decide which work I really appreciate more, then it has to be Rogers' work, having it more practical and real, and have more influence on the individual's personality, especially for future prospects.